Dear friends, as you would all agree, mental health is of utmost importance to all of us. But unfortunately, because of limited information, many myths associated with it, and unfortunately a lot of stigma which goes alongside unnecessarily has added on to problem in terms of patients not being able to timely recognize their problems, families at times neglecting the illnesses even if they are happening, and not being able to treat in a timely manner. I, Dr. Sameer Malhotra, Director for Mental Health and Behavioral Sciences at Max Group of Hospitals, Saket, would like to share a few facts about one of the major psychiatric ailments called as schizophrenia. There are predominantly two sets of symptoms that a schizophrenic patient goes through. The first set is the positive set of symptoms, which is reflected as add-on symptoms. When I say add-on, I mean things which other people are not able to go through individually. An example would be hearing things which others cannot hear, seeing things which others cannot see. As a result, a person suffering from schizophrenia may be seen talking to himself or herself, smiling without any reason, as if communicating with an imaginary person around. Many times they feel threatened and insecure and feel as if there are people who are trying to gang up against them, they are conspiring against them, or they are keeping an eye on them. As a result, they feel as if their camera is hidden around, or every movement of theirs is being monitored or talked about. That makes the schizophrenic person feel very insecure, threatened, which reflects in relationships in a negative way. The second major set of symptoms are the negative symptoms, where the person feels a disconnect from the rest of the world. They become socially isolated, they lose motivation and zeal and concentration. As a result, it becomes difficult to pursue one's job and daily chores, so much so that they may end up with self-neglect or absolute isolation from others around them. So it requires treatment. There is a strong role of genetic factors as well as environmental factors as major risk factors responsible for the onset of schizophrenic illness. When we talk about genetic factors, there is no single gene responsible for it. So people have talked about polygenetic inheritance, where there is multiple combination of genes which are responsible for this particular illness. What we also see is people who have been through traumatic experiences as a part of their birth or perhaps subsequent developmental history. There is an added environmental stress which adds on to the chances of a person developing the illness. When we talk about the risk factors, there is a strong family history of schizophrenia or related disorders in the family. We also see that there is a significant role of substance misuse, particularly drugs which can enhance the dopamine flow in certain areas of the brain, which can be responsible for certain insecure experiences that a schizophrenic patient goes through. All these factors put together are responsible for onset of schizophrenia. What we also see is that during the pubertal spurt, there is reshaping of the brain, and at that point of time, there are certain nerve connections which do get disturbed and flow of neurotransmitters which also get disturbed. Particularly so the role of dopamine across the mesolimbic tract. If dopamine goes high in the mesolimbic tract in the brain, it is responsible for certain odd experiences, hallucinations, and certain delusions that a person of schizophrenia goes through. And when dopamine goes low in another tract of the brain, which is called as the mesocortical tract, they start having the negative set of symptoms where they feel isolated, they feel that low on concentration, low on motivation, and they start neglecting themselves. It's not very difficult to treat schizophrenia, but it is very challenging to treat a person suffering from schizophrenia in the context that the person is living in. Major drawback here is, and the major challenge here is, that the patient of schizophrenia lacks insight and feels as if he or she is not affected with the illness, and perhaps it's the world which is conspiring against him, and it's others around him that do not know how to communicate or interact with him or her. So the major concern here would be treatment through standardized international guidelines and maintaining regular treatment compliance, which is a must for treating any patient effectively who's suffering from schizophrenic symptoms. It's also equally important to take care of how the family members interact with the patient, and that's where the role of family therapy and counseling comes in. Regularity of treatment both for the patient and counseling for the patient as well as the family becomes very, very important in overall treatment of any patient suffering from schizophrenia. When we talk about family therapy, the focus there is on trying to reduce the unnecessary emotional expressions which can at times interfere negatively in terms of prognosis of schizophrenic patient's illness. So we always tell the family members not to use undue warmth, not to overcorrect, not to over-criticize the patient, and try to understand as to what he or she might be going through in the process. It's also very important for the patient to maintain regularity of treatment through regular counseling and regular medication which is given as per international standard protocols and guidelines across the globe. But the medication has to be streamlined as per the patient's needs, the kind of symptoms that the person is suffering from, and also the side effect profile and the tolerability profile with that particular medication. So friends, psychiatric ailments can affect any individual, any part of society, any phase of life. So never be afraid and never shy away from recognizing those in a timely manner and getting them rectified in a timely manner through appropriate, timely professional intervention. If there are any comments, any suggestions, please don't hesitate in mentioning them and communicating it to us, and we would try to answer them to the best of our capability.